Hello, welcome to today's University of Wisconsin-Milwaukee Master Chat. I am Amy Lensing-Tate, Executive Director of the UWM Alumni Association, and it's my pleasure to introduce Rena Ghosh, who's professor in UWM's Department of Geography and a faculty member in the Northwestern Mutual Data Science Institute, as well as a professor in UWM's Urban Studies program. Her areas of specialization are cartography and GIS, urban studies, demography, environmental science, qualitative and quantitative methods, community-engaged research, and participatory mapping GIS. And Rena will introduce her doctoral student that was instrumental in this research and will be presenting today. Please write your questions in the chat, and we'll be sure to leave plenty of time at the end for ample discussion. I'll come back at the end and help moderate those questions. With that, it's my pleasure to turn things over to Rena.
It's a pleasure to meet you all via Zoom, Teams. We are here to present our research on social media disinformation and on COVID-19 and its effects. I would like to introduce Amir Forati, who is a doctoral candidate and is working under my supervision on this topic. So proceeding on to slide 1. As we are aware, COVID-19 has been a global pandemic since 2020, as declared by WHO, and it has affected tremendously global health. Over 6 million deaths have been caused. And however, its impacts on US have been equally strong in both the number of cases and in the number of deaths. So despite the high number of deaths, political and social resistance to containment measures have been quite profound, fueled by misinformation spread through social media. Social media is used quite extensively in US. This is a bar graph showing the percentage of users and numbers of users. And what we see is about 50% of US population is active on Facebook monthly, and over 80 million Americans use Twitter regularly. The effect of all of this on public health has been quite immense. This is because 59% of Twitter users have found Twitter to be an effective and reliable source for obtaining health information. So misinformation in social media has affected actual practices. And Dr. Fauci has noted that social media fuels the spread of disinformation and has impacted the pandemic more negatively than positively. Falsehood diffuses significantly further, faster, deeper, and more broadly than the truth. And COVID-19 false information has propagated at a fast pace, which has drowned out the health advice on COVID-19. Social media analysis provides us a way of understanding what's going on with regards to misinformation. Social media narratives provide insights into individual and collective human behaviors, as well as the complex social dynamics that are embedded within it. And spatiotemporal analysis of social media data also explains variabilities and occurrences across geographic spaces. And Twitter is a very popular social media platform. We used Twitter in our study as Twitter data contains microblogs containing tweets, which have a short message and metadata associated with it. And Twitter data provides also locations, locations that are geotagged with an exact location, or it mentions location where we can parse the tweet message to obtain the location of the tweet. And it also provides profile location where we can find out the location through other references. I will now ask Amir to introduce the project. Essentially, we were asking the question that can social media activity accelerate the spread of the virus?
Thank you so much. So the main research question in our study was, can social media activity accelerate the spread of the virus or not? In the midst of COVID-19 pandemic, fake news, misinformation, disinformation, and malinformation have caused an infodemic of false information. So our time frame of the study was summer of 2020, May, June, and July 2020. And our study area was United States. And we had 4 research objectives to obtain through this research. First, to investigate the relationship between COVID-19 incidence rate and social media activity, to identify and analyze the nature of false information in tweets through discourse analysis, to map geographic distribution of false information and investigate demographic characteristics of places of origin, and to examine the association between COVID-19 related misinformation on Twitter and the spatial variability of disease incidence. Here, we extracted about 85,000 COVID-19 related tweets, positive and negative. Everything about COVID-19 was about 85,000 tweets in time frame of our study. And we conducted qualitative analysis, and we used GIS for statistical analysis and map. On the map on the right-hand side of the screen, you can see the map of all the COVID-19 related tweets, positive and negative, throughout the United States. If you are wondering about which county has the most number of the tweets, these are the ranking: Los Angeles, New York County, Hudson County, New Jersey, Fulton County, Georgia, Queens County, in New York, Cook County, Illinois, Harris and Travis counties, in Texas, Kings counties, in New York, and Riverside County in California had the most number of COVID-19 related tweets per capita. These are mostly urban centers of United States. And when we are talking about these rates, we got to consider the digital divide and the fact that social media participation is not even throughout the society and throughout the country. So we expected to see higher participation in urban areas. To understand the association between Twitter misinformation activity and Twitter activity and COVID-19 incidence rate, we conducted a state-of-the-art methodology called multi-scale geographically weighted regression analysis in GIS. Turned out there is a direct relationship between COVID infection rates and social media activity. In other words, the more impacted by pandemic, the more tweets about pandemic. For example, on the right side, on the right-hand side of the screen, you can see the map of accuracy of the model. And in general, Twitter activity could explain about 80% of total variation of COVID-19 incidence rate, meaning that in 80% of the times, people who are impacted by pandemic are more likely to post something about COVID-19 on Twitter. If you look at the Wisconsin or Milwaukee metropolitan area, most of the tweets are coming from neighborhoods with high number of cases. And The darker areas are the areas that this relationship is stronger, meaning that in places like Milwaukee metropolitan area or these dark red areas, people who are living in neighborhoods with high incidence rate are posting more about COVID-19 pandemic. And our overall accuracy was 80%, which is acceptable and which is very high. And it highlighted the hypothesis of our study that people who are more impacted by pandemic are more likely to talk about pandemic. Then we manually examined about 45,000 tweets to understand the content and context of false information about COVID-19 pandemic. And based on our content analysis, we identified we grouped tweets into 3 categories: downplaying, misinformation, disinformation. And we added another category called suspected bot activity, and we filtered those tweets out. So we have downplaying, misinformation, and disinformation. And what's the definition of each of these? So downplaying is intentional minimization of risk, uncertainty, or effect of COVID-19. If we found out that one tweet is intentionally minimizing the risk of COVID-19, that would be categorized as downplaying. Misinformation is false information sharing without a clear agenda or personal gain, attributed to the lack of knowledge about COVID-19. So it's all about intention. And disinformation is intentional spread of uncertainty surrounding COVID-19 for personal or political gain. So if it's intentional, we call it disinformation. If it's unintentional, we call it misinformation. So we had to manually read all tweets and get into the bottom of all the tweets, read all the related links, all the comments, all the likes, all the profiles, to be able to understand the intention behind all of these tweets, in order to understand content and context of all these tweets. As you know, a lot of tweets are sarcastic, a lot of tweets, it's really hard to find the intention behind the tweets, and you need to read a array of tweets in order to understand the context there. So we manually read 85,000 tweets, coded them, and categorized them into these 4 categories. It might be interesting for you to see what are the most popular hashtags among tweets sharing misinformation. These are most popular hashtags used in these tweets that we found out: pandemic, COVID propaganda, no mask, end the shutdown, fund the FDA, mask free, biological warfare, health freedom, scamdemic, don't stay at home, government control, and Corona BS. These are the most popular hashtags that used in these tweets. And if you want to find some disinformation about COVID-19, you can search or look up these hashtags. It's more likely that tweets that are propagating false information contain one of these hashtags. In order to provide more context, here are some examples of tweets using these hashtags or propagating false informations. I'm going to pause here, and you can take a look at these tweets and read them. For example, lies they tell, bunch of hashtags. More tyranny from Dr. Fauci. Where are all the liars when you need them? Not letting the COVID communists stop me from seeing my friends and having good time. Don't be afraid to have a good time. Or this come from CDC website, some numbers that are not accurate or correct. So these are the type of tweets that we extracted from Twitter, and use them as in our study as false information or tweets that contain false information. In terms of numbers of tweets with false information and their categories, 43% of tweets with false information were trying to downplay the severity of COVID-19 pandemic. 40% included disinformation, which means they were intentionally propagating false information. About 14% misinformation, so they were unintentionally propagating false information about COVID-19 pandemic. And 3% of the tweets we found suspicious or suspected bot activity, and we filtered those tweets out of our data set. So all in all, first, most of the tweets were downplaying, then disinformation, then misinformation. In terms of geographic distribution of these tweets, on this map, the darker, the more prevalence of false information. So these are all the tweets that were extracted that contain false information in the United States. And the darker areas on the map, like in California, West Coast, and New England, some states in central region of the country, these are the states that had the most number of tweets with false information per capita. So in terms of ranking, District of Columbia came first, New Jersey second, Kansas, New York, California, Oregon, Washington, Hawaii, New Mexico, and Nevada. These are the top 10 states in terms of propagating false information about COVID-19 pandemic. False information and COVID-19 pandemic are dynamic processes. And interestingly, as false information were prevalent in summer of 2020 in these states, they experienced a massive surge in their known COVID-19 cases right after the study time period, highlighting potential repercussions of false information. So these states that are on top of the list experienced massive surges in their COVID-19 cases. And it can be potentially a repercussion of false information. These are the top 10 counties with the highest number of falsehood per capita. So at the county scale, these are the top 10 players. In Kansas, they are located in Kansas, New Mexico, Nebraska, Virginia, Kentucky, New Jersey, Oklahoma, Iowa, and Oregon. And the number of COVID-19 cases from May and June to early July has almost doubled in these counties, in these top 10 counties. So even at the county level, they are experiencing massive surges right after propagating falsehood, potentially because of the falsehood. Right after the time period of our study, they experienced massive surges in their cases. So let's take a look at their demographic and socioeconomic characteristics to see if there is any pattern there. These are the top 10 counties with the highest number of falsehood per capita. They are predominantly European American, 84% on average. They are middle-aged, 40 years old average. Middle income, 60K, median income. Low educational attainment, about 20% with bachelor degree or higher. Mostly rural with extremely low population density. And in terms of political orientation, 2016, voting patterns indicate a conservative mindset. 62% of population in these counties voted for Republican Party in 2016 election. So this can...
Sorry, I'm having trouble.
Sorry.
No worries.
So these are the demographic and socioeconomic characteristics of top counties with the highest number of falsehood in terms of COVID-19 pandemic. Then we conducted a topical content analysis to identify major topical areas of discussion in these tweets. We categorized all of the tweets into 4 major themes: politically charged myth, health-related myth, religious myth, freedom rhetoric myth. Politically charged myths such as demonizing pro-containment supporters, anti-state populist rhetoric, racial stereotypes, ridiculing expert or containments, or saying that COVID is a hoax. Health-related myths are like inventing fake cures, saying that vaccines are harmful, masks are harmful or ineffective, incorrect information about social distancing and comparing COVID-19 with flu and saying that it's not serious. Religious myths are those that said, those with information about immunity based on religious merit. And freedom rhetoric myths are those that said COVID is over, or they prefer economic liberty over safety, or individual freedom over safety. So we coded all the myths, as you can see on this table, and we categorized all of the tweets into 4 themes of topic. In terms of the nature of misinformation, proportion of false information displayed by category and topics in this chart. So about 56% of all the false information had a political theme. 25% advocating freedom rhetoric over public safety. About 14% were health related, like fake cures, and 5% religious merits. So immunity based on religious merits. So mostly we are dealing with it. So misinformation is politicized, and all the misinformation most of the misinformation regarding COVID-19 has a political theme. These percentages are for average of the United States, and they are different for each state. So let's see topical themes of COVID-19 false information at the state level. Here on this pseudo map, you can see the percentage of each theme in different states. So in some states, like Michigan, Indiana, Kentucky, Alabama, these blue lines indicate the political theme. In Alaska, Montana, Washington, Idaho, Oregon, Arizona, California, predominantly political misinformation, political theme of misinformation. In some states, freedom rhetoric is significant, like Minnesota, Wisconsin, Arkansas, Louisiana, Georgia, South Carolina, New York, Rhode Island, Colorado, Utah. And in some states, we have significant number of religious myths, like in Iowa, Missouri, Arkansas, South Carolina, Florida, Rhode Island, or Georgia. In these states, we have significant number of religious myths. And in some states like Nevada, Utah, California, West Virginia, we have a lot of health-related myths, or Maryland, that people are talking about fake cures and saying that vaccines are harmful or something like that. So this gives us a big picture in terms of themes of misinformation, and it shows us that there is a geographic pattern there, and it's not, so the national average does not hold for all states, and we need to conduct some sort of localized research if we want to make some decisions at the state level, because the states are different, and the proportion of the misinformation and type of misinformation, themes of misinformation, topics of misinformation are different. And another important issue here is that there is a geographic dependence as well. For example, as you can see in this area, most of the tweets are political. In this area, we have significant freedom rhetoric related tweets. In this area, we have significant religious related tweets. So there is some sort of geographic dependence as well, meaning that misinformation or certain type of misinformation tend to be concentrated in a specific area. In terms of myth, we identified false information myth and their geographic disinformation. And on this table, you can see different myths and the percentage of them. The most prevalent myth, which accounts for 17% of all the misinformation on COVID-19, is anti-state populist rhetoric. Then ridiculing expert and containment measures, then individual liberty over safety, demonizing prominent actors. 13% of tweets are demonizing prominent actors, 7% saying that COVID is a hoax, economic liberty over safety. I'm going to pause here and let you take a look at this list and see what are the most prominent myths and what are the least. For example, vaccine is harmful, or masks are harmful or ineffective. I think because of the backlash, they are not that prominent, but anti-state populist rhetoric or ridiculing expert or containment measures are pretty prevalent in terms of falsehood around COVID-19. Then we conducted, back to math, we conducted a statistical analysis called GWPCA to investigate the association between COVID-19 pandemic myth and to examine special patterns of false information, or we wanted to see what are the geographical pattern of falsehood in here. So in this map, again, we are seeing tweets per 1 million residents, false information, and what are the areas with highest number of false information. Our GWPCA methodology worked out very well. So from 87 to almost 99% accuracy in some areas. I don't want to get to technical details here, but if you had any question, feel free to ask in Q&A session or send us an email about the technical aspect of this issue. But just want to say that our statistical analysis accuracy was pretty high, between 87% for some areas to 99.66% in some areas. And in this map shows the accuracy of the model. First, most prominent myths are shown in this map. So in West Coast, fake cure is the most prominent myth. In Montana, ridiculing experts or containment. In some part of Midwest, economic liberty over safety. Illinois, Indiana, Missouri, and Iowa are mostly flu comparison. In southern part of the country, COVID is over. In Carolinas, Virginia, and Florida, religious myths are the most prominent myth. In New England and Michigan and Ohio, COVID is over is the most prominent myth. And in Wisconsin, individual liberty over safety is the most prominent myth. So I'm going to pause here and let you take a look at this map and see the geographical dependence in COVID-19 myth. It's not like fake cures propagated all over the place. And we are seeing that these myths are concentrated in certain areas. Like fake cures are all concentrated in the West Coast. And COVID is over is mostly concentrated in New England area and southern part of the country. In the Bible Belt and in some part of Midwest, economic liberty over safety is the most prominent one. Again, highlighting the geographical dependence of COVID-19 pandemic myth. Here is the second most prominent myth in these areas. Incorrect information about social distancing, predominantly in West Coast. In central areas, central region, COVID as a hoax is the second most prominent myth. In Midwest and Florida and Bible Belt, it's economic liberty over safety. Michigan, Ohio, West Virginia, and Kentucky, flu comparison. And the second most prominent myth in New England is religious myth. So again, in the second most prominent, we are seeing geographic dependence and the fact that people tend to propagate similar misinformation if they are located near each other. Now let's zoom into Wisconsin to see what are these patterns in Wisconsin, specifically for Wisconsin. Wisconsin ranked 24 nationally regarding prevalence of falsehood per capita. So we are in Wisconsin, the middle of the country. Misinformation is not that prevalent, and we are not that immune to misinformation about COVID-19 pandemic in Wisconsin. In Wisconsin, 60% of tweets were trying to downplay the severity of COVID-19 pandemic. About 20% were disinformation and 20% were misinformation. So intentional tweets or really harmful tweets with agenda were just 20% of the whole data set. 60% tried to downplay and 20% propagated false information without any intention or agenda. In terms of false information themes in Wisconsin, 61% of tweets were freedom rhetoric myth, 30% politically charged myth, and about 8% health misinformation. Health myths, sorry. So in Wisconsin, most of the false information surrounding COVID-19 nature is freedom rhetoric. People are prioritizing their freedom over public safety. So if we take a closer look at the false information myth in Wisconsin, we see that 30% is individual liberty over safety, 23% economic liberty over safety, and 7% COVID is over. These are all freedom rhetoric ones. Anti-state populist rhetoric accounts for 15% of tweets in Wisconsin, and ridiculing experts and containments, 8% of false information in Wisconsin. COVID as a hoax and flu comparison, or saying that COVID-19 is not serious, each of them is 8%, and shows that, again, freedom rhetoric and politically charged myths are the first and second most prominent themes of false information about COVID-19 pandemic in Wisconsin. These numbers are all for Wisconsin. Health misinformation, let's conclude. Health misinformation is a critical threat to global public health, and it can have disastrous repercussions for people if it's not taken seriously or managed. It can obscure credible healthy behavior like wearing a mask, hand washing, social distancing, and it can promote risky behavior that can affect individual well-beings. In our research, we showed that in the states and in areas that misinformation was prevalent, they experienced massive surges in their COVID-19 cases, highlighting disastrous consequences of health misinformation or COVID-19 false information. Our research provides empirical insight that can be utilized for effective public policy formulation at national, state, and local level. As we double down on the issue of local policy making, that misinformation and false information is unique to the area, and it's not one size fits all situation. And we use innovative methodology that advances social media data analysis and societal impact. And we provided a framework so other scholars can conduct similar research. And mainly our contribution to science was how to incorporate social media into both traditional and critical geography and GI science research. So when we are dealing with social media, we need to have a critical perspective when we are using conventional, traditional methodologies. And we tried our best to do that in our research. So far, our research has been culminated into 2 research papers that's been published in well-known journals, academic journals, that I have listed here, so you can take a look if you wanted to get more information about this research. And I have listed our email addresses. If you had any question, concern, anything that you wanted to share with us, feel free to contact us via email. And I highly encourage you to read these articles. They are talking about really, really critical issues. And thank you so much for your attention. It's almost 45 minutes, and I'd be happy to take questions if you have any. Thank you so much.
Amir, we do have one question that came in from the audience, if you can hear me. It's what can we do to combat misinformation?
So it's a really hard question. I think try to educate ourselves and be entitled to facts, and also acknowledge the fact that social media can be filled with misinformation, and not all information that we obtain through social media is credible. So just being cautious when we are referencing to social media, and try to fact check everything when we are going to make any decision about our health related behavior. Try to fact check all the information that we get through social media. That's my suggestion. I don't know if Dr. Ghosh has something to add.
Yeah, I would say that it's imperative that social media platforms conduct fact-checking, that they should be paying attention to that, because it can be manipulated, and false information has hurt people's well-being. So fact-checking from social media platforms, and policymakers should insist on that, as social media has tremendous influence on people's activities.
Okay, I'm curious, any preview on upcoming research projects, or what is next for either of you?
So we are, I'm sorry, I'm unable to turn the camera on for some reason. Maybe we can go back to out of the slides. We are conducting a number of different health-related research projects. One of them is on the opioid crisis that's going on. And we have received a big grant with Medical College of Wisconsin to study the opioid crisis. We have a number of publications on that. And so this is a big area of research we're looking into as well.
Great, thank you. Then I don't see any more questions on the live chat, but are there any closing comments either of you would like to offer to alums who are tuning in, or plan to watch later?
Well, we are delighted to present here as scholars and researchers and students from this institute. It's very nice to have this opportunity to share it with other alumni and other larger audience. So thank you for providing this opportunity. I hope the presentation offered some ideas and insights, and let us know if there's any questions.
Terrific. Thank you so much for sharing your time and your research with us. We really appreciate it. And a note for the audience, we will be returning to in-person master chats starting in next academic year in September. So you'll have an option to tune in on Zoom or be in the audience live. So we're looking forward to that as well.
Thank you.
All right. Thank you both.